Question 1. Which patient should the nurse assess first in a pneumonia care unit? A. A patient with oxygen saturation of 94% on room air. B. A patient reporting pleuritic chest pain. C. A patient with increased confusion and restlessness. D. A patient who has a productive cough with yellow sputum. Answer. C. A patient with increased confusion and restlessness. Question 2. Which task is appropriate to delegate to an experienced UAP when caring for a patient with pneumonia? A. Administer oral antibiotics. B. Educate patient on incentive spirometry. C. Assist with oral hygiene. D. Assess respiratory effort. Answer. C. Assist with oral hygiene. Question 3. The nurse notes a newly admitted pneumonia patient is tachypneic with diminished breath sounds in the left lower lobe. What is the nurse's priority action? A. Increase fluid rate. B. Administer prescribed antipyretic. C. Notify respiratory therapy for evaluation. D. Encourage fluid intake. Answer. C. Notify respiratory therapy for evaluation. Question 4. When teaching a patient about preventing pneumonia, which statement by the patient indicates a need for further education? A. I will get a flu vaccine yearly. B. I will avoid smoking cigarettes. C. I will avoid people with colds. D. I will not get the pneumonia vaccine again once I've had it. Answer. D. I will not get the pneumonia vaccine again once I've had it. Question 5. Which assessment finding requires immediate intervention for a patient with pneumonia? A. Oral temperature of 101.2 degrees Fahrenheit. B. Respiratory rate of 28 breaths per minute. C. Crackles heard in bilateral lung bases. D. Oxygen saturation of 88% on 2L nasal cannula. Answer. D. Oxygen saturation of 88% on 2L nasal cannula. Question 6. Which action by a nurse can prevent hospital-acquired pneumonia? A. Administering cough suppressants at bedtime. B. Encouraging early ambulation. C. Restricting oral fluids. D. Performing deep suctioning every 2 hours. Answer. B. Encouraging early ambulation. Question 7. A nurse is caring for an elderly patient with pneumonia who is refusing meals. What is the nurse's priority action? A. Consult a dietitian. B. Assess for swallowing difficulties. C. Offer nutritional supplements. D. Notify the healthcare provider. Answer. B. Assess for swallowing difficulties. Question 8. Which task should the nurse assign to an LPN/LVN in the care of a patient with pneumonia? A. Perform initial lung assessment. B. Titrate oxygen based on saturation levels. C. Administer oral antibiotics. D. Provide discharge teaching. Answer. C. Administer oral antibiotics. Question 9. The nurse observes a UAP positioning a pneumonia patient flat, in bed. What should the nurse do first? A. Document the observation. B. Instruct the UAP to elevate the head of the bed. C. Notify the charge nurse. D. Reposition the patient later. Answer. B. Instruct the UAP to elevate the head of the bed. Question 10. A nurse is planning discharge teaching for a patient recovering from pneumonia. Which instruction is the priority? A. Schedule a follow-up chest X-ray. B. Resume normal activities as tolerated. C. Increase fluid intake to thin secretions. D. Take antibiotics until symptoms resolve. Answer. C. Increase fluid intake to thin secretions. Question 11. The nurse identifies which patient as being at the greatest risk for developing pneumonia. A. A young adult with seasonal allergies. B. A middle-aged patient with controlled asthma. C. An older adult with chronic heart failure. D. A child with a history of ear infections. Answer: C. An older adult with chronic heart failure. Question 12. What is the most effective infection control measure to prevent the spread of pneumonia in a healthcare setting? A. Wearing a gown for all patient interactions. B. Administering antibiotics prophylactically. C. Performing frequent hand hygiene. D. Using sterile gloves for oral care. Answer: C. Performing frequent hand hygiene. Question 13. A patient with pneumonia becomes increasingly short of breath. What is the nurse's priority action? A. Notify the respiratory therapist. B. Administer a prescribed bronchodilator. C. Increase oxygen flow rate. D. Auscultate breath sounds. Answer: D. Auscultate breath sounds. Question 14. When preparing to suction a pneumonia patient with copious secretions, which nursing action ensures patient safety? A. Use clean gloves. B. Limit suctioning to 10 seconds per pass. C. Apply suction when inserting the catheter. D. Position patient flat, in bed. Answer: B. Limit suctioning to 10 seconds per pass. Question 15. Which order should the nurse question for a patient with community-acquired pneumonia? A. Obtain sputum culture. B. Encourage fluids. C. Administer antipyretics as needed. D. Provide deep sedation to promote rest. Answer: D. Provide deep sedation to promote rest. Question 16. A nurse is reviewing ABG results for a patient with severe pneumonia. Which value requires immediate action? A. pH 7.38. B. PaCO2 45 mm of mercury. C. PaO2 58 mm of mercury. D. HCO3 24 milliequivalent/L. Answer: C. PaO2 58 mm of mercury. Question 17. Which teaching point is most important for a pneumonia patient with impaired mobility? A. Perform deep breathing and coughing exercises. B. Wear compression stockings at all times. C. Limit activity to reduce oxygen demand. D. Increase protein intake. Answer: A. Perform deep breathing and coughing exercises. Question 18. The nurse is caring for 4 patients with pneumonia. Which patient should the nurse reassess first? A. A patient with temperature of 100.4 degrees Fahrenheit. B. A patient with new onset of confusion. C. A patient requesting pain medication. D. A patient with pulse oximetry of 95%. Answer: B. A patient with new onset of confusion. Question 19. When planning care for a patient with pneumonia, which goal is the highest priority? A. Maintain fluid balance. B. Achieve adequate oxygenation. C. Promote adequate nutrition. D. Manage body temperature. Answer: B. Achieve adequate oxygenation. Question 20. UAP is assigned to care for a patient with pneumonia. Which task should the nurse ensure the UAP understands? A. Monitor oxygen saturation. B. Teach patient to use an incentive spirometer. C. Report increased sputum production. D. Assess lung sounds. Answer: C. Report increased sputum production. Question 21. Which patient is most at risk for aspiration pneumonia? A. A patient with controlled hypertension. B. A patient with a history of seizures. C. A patient with type 2 diabetes. D. A patient with a fractured femur. Answer: B. A patient with a history of seizures. Question 22. The nurse is preparing to administer the first dose of an 4 antibiotic to a pneumonia patient. What is the nurse's priority action? A. Ensure 4 patency. B. Check recent liver function tests. C. Obtain a sputum culture. D. Assess for pedal edema. Answer: C. Obtain a sputum culture. Question 23. A pneumonia patient on oxygen therapy reports increasing shortness of breath. What is the nurse's first action? A. Notify the healthcare provider. B. Reassess vital signs. C. Call the respiratory therapist. D. Increase oxygen flow rate per protocol. Answer. B. Reassess vital signs. Question 24. Which dietary choice should the nurse encourage to support lung healing in a pneumonia patient? A. Low-fat yogurt. B. High-protein eggs. C. White bread toast. D. Unsweetened tea. Answer. B. High-protein eggs. Question 25. The nurse should question which order for an elderly patient newly diagnosed with pneumonia? A. Place on 2L oxygen via nasal cannula. B. Encourage fluid intake of 3,000 milliliters per day. C. Administer 4 antibiotics as ordered. D. Withhold pneumococcal vaccine until discharge. Answer. B. Encourage fluid intake of 3,000 milliliters per day. Question 26. A UAP asks the nurse how often to perform oral care on a ventilated pneumonia patient. What should the nurse advise? A. Every 2 hours. B. Once a shift. C. Before meals only. D. Every 8 hours. Answer. A. Every 2 hours. Question 27. Which statement by a pneumonia patient indicates a need for further teaching? A. I will continue my antibiotics even if I feel better. B. I will stay hydrated to help clear secretions. C. I will rest and gradually increase activity. D. I will stop using my incentive spirometer once my fever is gone. Answer. D. I will stop using my incentive spirometer once my fever is gone. Question 28. A patient recovering from pneumonia complains of fatigue. What is the nurse's best response? A. You should be fully recovered by now. B. Gradually increase your activity level. C. Drink caffeinated beverages to boost energy. D. Take vitamin supplements until energy returns. Answer. B. Gradually increase your activity level. Question 29. The nurse should include which instruction when teaching a pneumonia patient to use an incentive spirometer? A. Exhale forcefully into the device. B. Inhale slowly and deeply through the mouthpiece. C. Hold your breath for 1 second. D. Use it only when short of breath. Answer. B. Inhale slowly and deeply through the mouthpiece. Question 30. Which action is a priority in the plan of care for a pneumonia patient at risk for sepsis? A. Monitor blood glucose levels. B. Obtain blood cultures as ordered. C. Provide scheduled antipyretics. D. Encourage early ambulation. Answer. B. Obtain blood cultures as ordered. Question 31. Which sign is most concerning for possible respiratory failure in a pneumonia patient? A. Tachypnea. B. Wheezing. C. Use of accessory muscles. D. Productive cough. Answer. C. Use of accessory muscles. Question 32. The nurse should assess which parameter first after a pneumonia patient receives an opioid analgesic? A. Pain level. B. Respiratory rate. C. Blood pressure. D. Heart rate. Answer. B. Respiratory rate. Question 33. The nurse is evaluating the effectiveness of antibiotic therapy for pneumonia. Which finding is the best indicator of improvement? A. Decreased white blood cell count. B. Improved appetite. C. Clear lung sounds. D. Resolution of fever. Answer. C. Clear lung sounds. Question 34. The nurse notes a pneumonia patient has a sudden drop in blood pressure and cool, clammy skin. What is the nurse's priority action? A. Call the rapid response team. B. Administer a fluid bolus. C. Place the patient in Trendelenburg position. D. Increase oxygen flow rate. Answer. A. Call the rapid response team. Question 35. A pneumonia patient is prescribed 4 antibiotics, oxygen therapy, and acetaminophen. Which order should the nurse question? A. For ceftriaxone, 1g daily. B. Oxygen via nasal cannula to maintain SpO2 greater than 94%. C. Acetaminophen 650 milligrams every 4 hours as needed. D. Bed rest with bathroom privileges. Answer. D. Bed rest with bathroom privileges. Question 36. The nurse is caring for a patient with pneumonia and a history of chronic kidney disease. Which lab value requires immediate attention? A. WBC 10,000/mm superscript 3. B. Creatinine 2.8 milligrams per deciliter. C. Hemoglobin 13g/dl. D. Sodium 138 milliequivalent/L. Answer. B. Creatinine 2.8 milligrams per deciliter. Question 37. What is the priority teaching point for an immunocompromised patient receiving the pneumococcal vaccine? A. Expect mild flu-like symptoms after vaccination. B. You will not need any further pneumonia vaccines. C. Report any injection site redness immediately. D. You may need repeat vaccines based on your condition. Answer. D. You may need repeat vaccines based on your condition. Question 38. The nurse is planning care for a patient with pneumonia who is experiencing anxiety and dyspnea. What is the priority nursing intervention? A. Encourage deep breathing exercises. B. Administer anti-anxiety medication. C. Teach relaxation techniques. D. Provide frequent rest periods. Answer. A. Encourage deep breathing exercises. Question 39. Which finding indicates a therapeutic response to albuterol in a patient with pneumonia? A. Increased productive cough. B. Decreased wheezing. C. Increased heart rate. D. Drowsiness. Answer. B. Decreased wheezing. Question 40. The nurse is evaluating delegation to a UAP. Which delegated task requires follow-up? A. Assisting patient with ambulation. B. Reporting increased dyspnea. C. Monitoring pulse oximetry trends. D. Assisting with oral care. Answer. C. Monitoring pulse oximetry trends. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.